A very good evening, everyone. I'm Lisa Lord. This is a COVID-19 media briefing and update. As you know, Barbados has recorded a spike in cases. We will be addressed this evening by the Minister of Health and Wellness, Lieutenant Colonel the Honorable Jeffrey Bostic, the Chief Medical Officer, Dr. Kenneth George, Dr. Leslie Rollock, the Senior Medical Officer of Health, who is joining virtually, and the Manager of Quarantine Facilities for COVID-19, Mr. Alvin Hart. Before we open the floor for questions, we will have opening statements by the officials, and we will start with Minister Bostic.
Thank you very much, Lisa. Good evening to viewers and listeners, and a special welcome to members of the media. You may recall that during the last two press conferences, I would have indicated that, yes, we were seeing an increase in the number of cases, even though we were not worried about the numbers because in the general scheme of things, the positivity rate was still quite low. What I did say on those two occasions was that what was worrying the Ministry of Health and Wellness was what we were seeing in relation to the cases that we were having. And I'm referring to, for example, that there were a number of symptomatic cases and also a number of persons who were presenting to Accident and Emergency Department with symptoms that later manifested themselves into being positive cases. And these are the things that were worrying us at that point in time. Well, today, we have a spike in cases, as Lisa indicated, and the numbers are, yes, worrying on this occasion. And what we are seeing has made us come to the conclusion that there's some measures that we will have to introduce in order to deal with the situation. I am going to hand you over to Dr. George, Chief Medical Officer, and his technical team, and they will go through the data with you, and then I will come back to speak to how we as a country intend to respond to the recent developments. Over to you, Dr. George.
Thank you very much. Thanks so much, Minister. So with the information that the Ministry of Health has gotten as of the 10th of July indicates the following. There were 908 tests done, and out of that number, there were 40 new cases of COVID-19 in Barbados, 20 males, 20 females. In addition to that number, there are 6 other persons who are going for assessment today. So therefore, those 6 persons will be assessed at Harrison's Point, and a decision will be made if those numbers will be added on tomorrow's schedule. This is indeed an alarming number. However, on the good side, our positivity rate, including this new numbers out of yesterday, has risen from about 0.7 or 0.6% to 1.6%. So there has been a jump of 1%. In addition to that, our cases per 100,000 every fortnight is now at 38. Please recall we were at as low as 19, and it is now at 38. So what consists of the numbers we are presenting to you this afternoon? Of major concern is a church in St. Michael, which recorded 33 new cases. Many of these cases, almost all of these individuals actually, are in hotel quarantine. This has been the Ministry's position with respect to our contact tracing and to making sure that individuals who test positive and the contacts of these individuals will go into quarantine at designated hotels. So the church had 33 individuals. In addition, there is a large business house which has 21 members in total that have tested positive. If you look a little closer within that business house, 9 persons were actually working within the confines of the business house. 10 persons were close contacts, and 3 others were family members. In addition, we are also looking closely at a family within St. George that has a total of 10 individuals that have tested positive. There is another business establishment with 4 individuals, and in addition to that, we had a total of 3 persons who entered our borders, and they came on a Caribbean Airlines flight, and those 3 individuals tested positive for coronavirus. We are monitoring 3 young children who presented to Winston Scott Polyclinic, all independently. And these children presented with gastrointestinal symptoms. This is a bit of abdominal pain and diarrhea. Quite an unusual presentation for COVID. So we should keep that in mind. So the situation in Barbados is that we are not in a good place. And that's why we are again reaching out to the public for their complete cooperation. We have several cases that we are contact tracing. We intend to put all primary contacts into hotels across Barbados until they are first tested and second tested. That's an overview. Leslie, I don't know if you would like to add any additional information with respect to the cases and the contact tracing program of the Ministry of Health and Wellness.
Thank you, Dr. George. Thank you, Dr. George. The overview of the number of cases and clusters is as you indicated. What we have been concerned about is that what we are seeing both in the church and the work cluster is that the protocols are evidently not being followed in those places. We expect that among family members that practically all of the family will be affected, but in the workplaces and the churches where protocols are supposed to be being upheld to reduce contact among the work members, we are concerned that we are seeing these things in those places. So in addition to those 4 main newish clusters that we have been seeing, we also have a few smaller ones with 2 persons and 4 persons and so on. Thank you.
Thanks for that, Leslie, and I'm sure we will come back when there's the question and answer part of the segment. I, however, would like Mr. Alvin Hart, who is our quarantine facility manager, to make a few comments as to how we manage situations like these and what efforts are being taken by the Ministry of Health and Wellness to protect persons who haven't tested positive just yet.
Good evening, Dr. George. Thank you. Good evening, Mr. Minister. And good evening, Dr. Rolla. Good evening, Barbados. Yes, I'm going to bring you up to date on the measures that we have taken in the way of quarantining of primary contacts from the community. We have been using a number of hotels over the past couple of months to quarantine individuals from the community. To date, for this cluster that we're having, we are using about 6 hotels at present. This is the Dover Beach Hotel, Time Out Hotel, Barbados Beach Club, Dover Beach Hotel, and the Sugar Cane Club. As the numbers increase, the more hotels we have to use and the more room stock we require. So the Ministry of Health saw it necessary that we quarantine all primary cases. Early in the pandemic, we used to allow primary cases to stay at home, but we found that they were not staying at home, they were moving around, and we were seeing large number of positive cases coming out from primary contacts. So this is one of our measures of reducing the number of positive cases from primary contacts. So I'm just going to share some statistics with you on the number of persons that we have in quarantine at the moment. So in total, as around 3 o'clock this afternoon, we have about 180 individuals in hotel quarantine. We have the individuals from the large establishment that Dr. George spoke about. We have a number of those. We have over 70 of those in quarantine. We have almost all the members of that church cluster who are not in quarantine as yet. They are heading to quarantine, and the entire membership of that church should almost be in quarantine, that our primary contacts would be in quarantine by 6 o'clock this evening. We also have all of those from the different family clusters that are out there, and they're in quarantine as well. So in total, as I said, we have about 180 persons in quarantine. By the end of the day, we should have around 200 persons in quarantine within these hotels. I really want to use this opportunity also to thank the staff and the management of these hotels. These persons have gone beyond the call of duty to assist us in making these measures work. You know, these are almost like members of the Ministry of Health. You know, they work with us, they ask us questions, they share information, and this is what we want. But what we also want is that for everybody else to play their part. I also want to thank the quarantine team for their work. We have deployed nurses throughout the quarantine hotels. So almost every quarantine hotel has a nurse where we can address the concerns of the clients, where we can also do the second testing as well. So the room stock we have currently is 170 rooms throughout the hotels. By the end of the day, we should almost use all of those, but it's a rolling stock because retesting, second testing, which is very important in quarantining of persons, we have started today, and today we retested about 18 persons. Tomorrow we will retest a very large number, and this will be a lot of persons from that large establishment. We'll be retesting about 71 of them, and we have the entire schedule for the entire week, how much we'll be retesting. So every day we'll be retesting persons, and also based, the number of persons coming into quarantine will be based on the amount of positive cases that we see tomorrow and the following day. And so persons will be going and persons will be coming. But what we want is that the numbers keep falling and there's no significant rise in the numbers. So quarantining is a critical component of the fight against COVID-19, along with all the other measures. And we will continue to quarantine people in hotels that are primary contacts as long as it's warranted.
Thank you, Mr. Hart. So you have a synopsis as to exactly what is happening at this point in time. And let me say that we have been here before. And yes, this presents a challenge to us, but it's not a challenge that we cannot overcome. We are not overwhelmed in any way. All of our major operations have the capacity to do what they're designed to do, from testing and swabbing, isolation, quarantine, and providing general medical and clinical care. So we're not overwhelmed. And I think that we will remain in that position as long as we take the appropriate steps that are required in this situation. And when I speak to we, I am referring to the Ministry of Health and Wellness, the government in general, and each and every citizen. All of us have a role to play in this process. So from the ministry's perspective, our intent is to execute a three-phase operation to be able to deal with this matter. The first part of it has to do with aggressive, and I mean very aggressive contact tracing, and that has started from early this morning. And the ministry intends to make available all of the resources, human and technical, to those persons who are responsible for conducting this exercise on the ground on behalf of the ministry. I'm talking about the medical officers of health within the polyclinics and the various catchment areas. And this will be followed, obviously, by trying to get people into quarantine, primary contacts, as Mr. Hart spoke to just now, so that we can test them and isolate them if necessary, and this will assist us in terms of containing this recent spike. The other part of the exercise has to do with aggressive community testing. And we were here before several months ago, and I thought that we had exited that phase. But because of the number of persons who are presenting late at accident and emergency and doctor's offices with symptoms, this suggests to us that we need to get back out into the community and appeal to persons, and I know that the CMO will probably speak to this later, but appeal to persons who have symptoms or who are not feeling well to be able to do what is required for us to do the necessary testing. And then the final part of this has to do with the restriction of movement. And this is absolutely necessary if we are going to contain this current spike. And why is it is going to be necessary? First of all, we need to be able to reach all primary contacts. And some restriction of movement would allow us to be able to do this. And secondly, we need to contain the spread, person-to-person contact, because we have learned from back in January, February, and March that we have to move with lightning speed to contain any outbreak of this nature so that it doesn't become a big problem to the country, and that is exactly what we are going to be doing. So in this regard, there are a number of measures that we are going to implement from Tuesday, the 17th of July, and these measures are intended, the 13th of July, Tuesday the 13th of July. And these measures are not intended to make people miserable at all, at all, at all. We have to go this route because we think it is necessary to do so, and we are going to be expecting and anticipating the usual cooperation and collaboration of all Barbadians and visitors and residents in this country. So the measures will start, as I said, from the 13th of July, and they will run for a period of 2 weeks. And during that period, we will assess the situation, see exactly where we are. If we're able to contain this current spread quickly, as I'm hoping, and I know that all of us in the Ministry of Health, we are hoping, then we may be able then to go in a different direction at the end of 2 weeks. If we have not been able to, then we will have to come back to you and tell you what else we are going to do. So with effect from Tuesday, 13th of July, the curfew will be reintroduced every day from 11 p.m. to 5 a.m. From 11 p.m. to 5 a.m. every day from Tuesday, 13th of July. There will be no social gatherings such as fetes for at least the next 2 weeks until we are able to get a handle on the situation at the moment. Attendance at churches, cinemas, and other indoor settings will be capped at 100 persons. In relation to funerals and weddings, based on spacing, we're going to cap those at 100 as well. And I know people might have been looking forward to the summer camps, but we are going to delay those for the next 2 weeks. For the next 2 weeks, summer camps will be delayed. And regrettably, but we think it necessary, that full contact sports, and I know that they've only within the last few weeks been able to recommence their activities, but we are going to have to put those on hold for the next 2 weeks starting on Tuesday. There will be no spectators at sporting events, and that includes cricket, for the next 2 weeks, and dance studios and clubs will be put on pause for 2 weeks as well. We are going to ask for those persons in the public transportation sector that you do not go past 75% of persons in the buses, and I'm speaking of seated passengers, in that no standing will be allowed. And this is an interesting one because I have seen, and I know that people generally have been following protocols, but I've seen a few things of late that were frightening, including one coach with, I estimate, had to be about 100 people, and the amount of people that were standing and really packed like sardines. We cannot allow that to continue given what we are facing at this particular point in time. And the last measure is that we are going to advise that wherever possible, persons who can be allowed to work from at home. And this would also give us some space in terms of movement of persons and the ability to be able to conduct the necessary contact tracing. So those are the measures that will be effective from Tuesday 13th, and the directive will be amended accordingly, and you will hear from the Attorney General on that matter to bring these things legally into effect from Tuesday. I want to repeat that these measures are not intended to make people miserable, but we have to look after the safety and the security of the country. And I would take this opportunity really to appeal, and I've done so on several occasions. I know that people might be suffering from COVID fatigue. Our staff in the ministry, we've been going at it for a very long time. We've been here before, we keep coming back, but this is the nature of things. We expect that we will have COVID cases because there's no country in the world that will exist without COVID cases, given the nature of things at this point in time. However, what we are seeing really is not good in terms of how people are treating the protocols. I have repeated on many occasions from early in the game that with vaccines or without vaccines, with people coming into the country or people not coming into the country, at the end of the day, it is up to each and every single one of us to follow the true and tested, scientifically tested protocols. Mask wearing, physical distancing, sanitizing, respiratory etiquette. These are the things that will save us. And I really beseech you, Barbadians, visitors, residents, please adhere to the protocols. If you do that, we can defeat this in as short a period of time as possible. Give us the opportunity to be able to do so that we can return to where we were 2 weeks or 3 weeks ago. And we want to be there, and we want to be there quickly. So it's up to you, it's up to us, it's up to me, it's up to all of us to be able to achieve this. And I beg you and hope that you will cooperate and collaborate as you have done in the past. Over to you, Lisa.
Thank you very much, Minister. Now, as we open for questions, I'll just ask members of the media to introduce themselves and the media house they represent before posing their questions.
Good afternoon, Barry Ali from the Nation newspaper here. I have 2 questions for Dr. George, the Chief Medical Officer.
Go ahead, Barry.
Dr. George, good afternoon. By chance, based on the spike that we are now seeing, could this be the result or the manifestation of a new, more infectious variant of the COVID-19 virus? That's the first question. And the second question would be, out of this recent spike, have you guys seen any people who are actually vaccinated, or just like the last time, is this a case of majority of these people who are now testing positive are unvaccinated Barbadians?
So with respect to the variant, we in the ministry, as you know, have been sending CARFA samples from time to time. we are in receipt of samples that were shared with us about 2 days ago. The samples were 18 samples in all. 18 samples were tested. 9 of those samples were the alpha variant, which is B117. 3 of the samples were the delta variant, and 3 of the samples were the gamma variant. What I would hasten to say is that based on information that we have, those cases of Delta were imported cases. So there is good reason to believe that the original first mutation of that caused significant public health concern across the globe, which is B117, that B117 is here in Barbados, and that persons need to know that variant is within our country. The good thing about it, though, is that the prevention and control measures remain the same for the variants, particularly when it comes to vaccination and the measures that the minister just so clearly indicated. So with respect to the variants, yes, there are variants in Barbados as we speak. Fortunately, the ones of immediate public health concern that everyone speaks about is from persons who have traveled. And that is where we are with that situation. Thank you.
And the second part of the question related to vaccinated
With respect
persons.
to unvaccinated, tested positive, Dr. George, or vaccinated ones.
So there have been 3 persons who have arrived in Barbados who have been previously vaccinated and have come to Barbados. And as part of our protocols, they have turned a positive test. So those are persons who came through our port of entry, and we are monitoring that situation. With respect to persons becoming sick who are vaccinated, that is extremely uncommon worldwide, and that is the experience of Barbados to date. And that is why we encourage you in the Ministry of Health, please, those who are not vaccinated, this is one of your best chances of making sure that you don't get very ill and that you transmit disease less. Thank you.
Any further questions?
Good evening, Sean Robinson for Capital Media. Since the passage of Hurricane Elsa, the Paragon facility, the island's main quarantine center, was damaged and is now off the list for quarantining. I would just like to know how soon should the Paragon facility be back up and running as a quarantine facility?
Thank you very much. I'm not sure that I agree with you that the Paragon facility is the main quarantine facility, and I say that because we have moved away from that kind of a quarantine facility into hotel quarantine, and that is really where the emphasis is. But the Paragon facility, yes, we have to do the work that is required to bring that back on stream, and we are waiting word as to how long that is going to take. And as soon as we have that information, I'll be able to share it with you. But in the meantime, the hotel quarantine and designated hotels for quarantine purposes, that is still an option that is available to every person.
Barry, you had a follow-up question?
Well, yes, thank you. I actually had a follow-up question for the minister, so I hope he doesn't move away too quickly. Minister, based on the information just presented by the Chief Medical Officer, that we now actually have 3 separate active variants, Delta, Gamma, and Alpha within our midst. Will the subcommittee, the COVID-19 subcommittee that is within our cabinet framework, will we now be doing another review of our protocols in light of these samples coming back from Carver that now show we do have 3 separate virus variants in our midst.
Barry would have reported on these 3 variants previously because we would have sent samples before that confirmed this. But in terms of, well, it depends on what you mean by active variants, because as I stated on previous briefings, and I will repeat again, those who arrive with the Delta variant and the Gamma variant, we were able to get those at ports of entry, the port of entry to Grantley Adams International Airport, through the very protocols that you're talking about, which were designed to do exactly that. So that the whole process of testing on arrival, quarantine testing, that has worked for us, and that has allowed us to be able to capture those persons. And we would have done all of the contact tracing in relation to any primary contacts from those persons with Delta and Gamma, and we were satisfied in our minds that they had not entered the community. So that is why I'm not in agreement with you in relation to the fact that they're active. But yes, we reported them because they arrived on island. Now the Alpha variant, that has been active in the country, and that is the one that gave us the trouble back in January, February, and that remains active. It might have been a bit dormant for a while, but it remains active. And I cannot say it, I mean the medical persons are here, but based on what we saw back in December, January, February, I cannot say that we are seeing that at this point in time. Yes, there have been an increase in cases, and this one today of 40, that's a fair amount, I would admit. But we have to see exactly where this is going to go before we can make those kind of determinations. And I want to stress the fact that we have had cases that have bothered us, not because of any variant, but because people presented very, very late, symptomatic persons, including symptomatic persons in business places who were going to work. And that is why we were actively pursuing those contacts. And I thought that we had done a pretty good job in that regard, but we have to look and see exactly what has led to the 40 cases that we have now, and we're going to take all necessary actions to be able to resolve or to deal with those. In relation to the protocols and entry protocols, we consistently or continuously review and revise as necessary our protocols over a period of about 2 to 3 weeks, and that process will continue. So it's no hard and fast thing with us. It depends on what we are seeing on the ground.
Question for Dr. George. Dr. George, with respect to these 40 new cases, these persons presenting, the majority of these new cases are symptomatic or asymptomatic?
So that is the challenge, and Corey has been speaking about this. Persons are coming in with symptoms, and this is worrisome. Why? Because when you come in with symptoms, your CT values tend to be low, and that means that you're quite infectious. And if you're going to wait for a long period of time at home or even in your workplace, even with mild symptoms, that is the period when the virus is being transmitted. So one of the messages tonight is again asking the public, if you're symptomatic, and as I indicated, if you're symptomatic with respiratory symptoms, or if you are a child with gastrointestinal symptoms, please present to your doctor or your nearest polyclinic, and we will do the appropriate assessment. So it is important that persons present early, and the other major issue I implore Barbadians is to cooperate fully with the contact tracing team. I have spoken about this before, but it is important for full transparency so that the people on the ground can do their work. It doesn't make any sense if you give information only about half your contacts. We need full disclosure. We handle that information in a very in a manner that doesn't compromise persons' identities, etc. But at the end of the day, what we are trying to do is protect all members of the public.
Are there any further questions?
Good.
One more question for Dr. George. Dr. George, I know Dr. Ford is not here, but can you give us a quick synopsis of the Harrison Point facility in terms of how many patients are there that are in primary or tertiary care? Or, I know Dr. usually has these numbers, but
Right.
just
So I don't have those numbers immediate to hand, but what I will let you know is that we have been working with Corey Ford to make sure that he has the ability to respond to a situation like this, and he does. So therefore, he is making arrangements and is working with Mr. Hart and his team to make sure that the services are covered with respect to staffing and our ability to house individuals in primary, secondary, and tertiary. I believe the total number at the center at the moment is 69 individuals.
I do believe that someone else was waiting to ask a question.
Yes, good evening to the panel. Shamar Abdullah from Barbados today. A question for the minister. You would have mentioned that the business and the church, which would have obviously led to this jump in numbers, they would have been pretty much disregarding the COVID-19 protocols. Has this been a thing you've been seeing in other businesses? Has it been a widespread thing that the COVID market has been seeing over the last, let's say, a couple of weeks? And follow-up question, I know that you said that for the next 2 weeks, we'll be on sort of a go-slow thing, trying to get control of the numbers. But in regards to the fething that's supposed to start back at some point this year, I know there was talk about having a database for persons who, when they're tested, the ministry can keep track of them for when they're, eventually go to the feds and stuff. Has the ministry made any headway on that?
Dr. George. Yeah, because he is the person that's referred to those two clusters. At the moment, as I would have indicated in the measures that we're going to be taking from Tuesday, one of those measures has to do with the fact that all FETs and all of related activities will be put on hold for the next 2 weeks. In other words, there will be none for the next 2 weeks, at least in the first instance, until we get a handle on what is going on at this point in time. So that would include even those 150-person events that we would have spoken to a couple of weeks ago. All of those are put on hold for the next 2 weeks. Maybe answer the first question.
So with respect to cooperation, so what we are noticing is that when you go into businesses across Barbados, you get some businesses do a temperature check and you get hand sanitizing. The worrisome part of many of these businesses is the operations that you don't see. So, and we have good reason to believe those operations include how people mix and mingle within the business. There's a feeling of comfort with your peers. And the worrisome part of this is where persons mix, for example, when they have their lunch break or other breaks, they are close to each other, they are not social distancing, and they are not wearing their masks. So it looks like a facade that what is happening in the front of the business is not necessarily what is being translated in the back of the business. And we have had, at least on 2 occasions, where we are absolutely sure that the practices within the businesses are falling below par. Businesses across Barbados must review their protocols consistently and frequently and make sure that their staff are practicing the basic guidelines that have been given by the Ministry of Health and Wellness. So there is good progress in some areas, but in other areas we are letting our guard down. I would just like to say that there are many times in Barbados we move around and we are seeing persons congregate in small groups of 5 to 10 people, and they are not doing the right thing. So this break for 2 weeks gives the public a chance to quiet things down, while we in public health try to get on with the work of the contact tracing and try to make sure that Barbadians are kept safe. Thank you.
I would like to support Dr. George here and to add something as well. The businesses, and I go into a number of businesses, supermarkets and so on, and to be honest with you, for the most part, I feel quite safe. And I feel safe because what I see, really, I see protocols that are effective and protocols that are being followed by persons. I think it's a personal choice that we have. If I go into an establishment and the protocols are not there, then I tell myself, this is not for me, and I leave. But also, when I go into any establishment, I am confident because I'm looking after myself as well, in terms of wearing the mask and doing the things that the public health officials say that I'm supposed to be doing. And I would like to invite and encourage every single Barbadian to do the same. Follow the protocols, even if you're going into business establishments. And if you follow the protocols and you do the right thing, generally speaking, you'll be safe. And I hope that you will take that on board. Thank you.
Tonisha Rockyaw from Starcom Network.
Yes, good evening. Minister, what steps will be taken against businesses and churches found to be lax with the protocols? And what will be done to police the protocols in the future?
Well, as you know, we have a COVID monitoring unit, and we get some support from the Royal Barbados Police Force. And that has been very effective. In fact, a number of businesses, a number of persons have been taken to court, tried and convicted, and that will continue. And I don't want to signal out churches or any specific institution. I would say that the protocols are there, and just like the laws of Barbados, there are people who are responsible for enforcing those protocols. There's a bit of latitude in the sense that we do not want, generally speaking, to have to do that. We do not like having to close down businesses, and so we try to speak to the owners so that they would make any corrections that are required to the way they're conducting the business within a COVID environment. But I must stress here, and I will at this point in time, that I'm going to be having another meeting with the management of the COVID monitoring unit, because we have to enforce the protocols, and where people are not doing it on their own, then we have to take the necessary action to ensure that they do, if we are going to keep Barbados safe. And that is really what we are going to be doing going forward, continuing to do what we were doing before, but all of us have to up the game, because obviously we are seeing some signs that are not good for the country.
Aaliyah Briggs, CBC News.
Aaliyah. 1 second, Aaliyah, 1 second. Mr. Hart wants to make a comment at this time.
Another worrying thing we are seeing coming out of businesses is individual responsibility to their workplace and to the safety of others, where persons are having symptoms and going to work. I can remember speaking to someone in quarantine quite recently, and he said, I had a little cold, and I went and I bought some Panadols, and I went to work. That same institution or that same workplace had a very large cluster of cases over a few weeks ago. So the individual in the workplace also have to take responsibility for their health and for others. If you are not feeling well, if you are having respiratory symptoms or any symptoms related to COVID-19, go to your nearest polyclinic or go to your private doctor and seek medical attention. All you are doing is putting the entire population of that business and your family at risk. And it only takes one COVID-19 positive person in a large establishment, like what we're seeing, to cause a cluster like this. So we are asking persons to take individual responsibility in preventing the spread of COVID-19.
Aaliyah Briggs from CBC.
Dr. George, you mentioned earlier that 3 cases were identified on a Caribbean Airlines flight. I'm aware that late last month, a travel bubble came into effect, which allowed vaccinated travelers to enter the island without a second PCR test. Would you be able to say whether or not those 3 positive cases were in any way linked to the bubble? Or would you be able to provide the origin of those cases, the country of origin?
So I'm not going to speak to the country of origin, but let me assure you that those individuals did not travel from any bubble country. We have instituted measures that update the risk ranking of countries on a continuous basis. So when we rank a country as low risk and place them in quote unquote the bubble, we realize that the fortunes of those countries can change at short notice. And therefore, what we will do is to make sure that that list is updated extremely frequently. Every 2 weeks, we're going to be making changes to that list because we know that Barbados's fortunes have changed very quickly over the December-January period, and many countries' fortunes can change very quickly in a few days. So that is a work in progress. We are working together with the BTMI on that. And the other issue I would let you know is that we have extended the list of countries that are of particular concern to Barbados, and those persons coming from those countries will require to do not 5 days quarantine, but 7 days quarantine. As the minister has indicated, we continue to look at our protocols on a weekly basis, and if changes are to be made, they are so reflected.
Doing a final check with members of the media to ensure that you're satisfied at this time.
This is Crystal Boyne, Barbados Advocate. I just have a quick question.
Sure, Crystal, go ahead.
Yes, good evening. I just wanted to ask Dr. George a question. He did mention that there were some young persons who had COVID that presented, I believe, to the polyclinic. I just wanted him to elaborate, why are these symptoms more worrying, or what were the symptoms in children, if they were, what they have seen so far as it relates to symptoms of COVID in young children or young people, and what that really means for something like if you're having school or camps or any mass gatherings for young persons, what that really means.
So thank you so much. At the beginning of the COVID outbreak, and even now, we always said that children and teenagers have generally a good course and present without any symptoms. Our experience, particularly in recent times, is that children are presenting with symptoms across the spectrum. The symptoms are typically respiratory, but what we have been finding is that the symptoms have now been gastrointestinal. And therefore, parents who have a child at home, if they are uncertain, please come to the nearest polyclinic or your private physician to have that child being assessed. As part of the contact tracing for those kids, the parents were also positive, but the parents might have been having mild disease in retrospect. But the initial point of contact with the healthcare system was through the child interacting with the system for a minor type complaint. I implore persons, if you are uncertain, go to our polyclinics. We are there to help you. We not only do testing for exit purposes, we do our predominant mandate is to make sure that persons in Barbados wherever they are, can come and be tested either at the gymnasium that is fully operational and functional now, or at the Brantford Tate Polyclinic or the Eunice Gibson Polyclinic, and we also accommodate persons at Winston Scott Polyclinic. So we are there to provide the service, and persons are asked to step forward so that they can be tested.
Thank you, Dr. George. And I'll ask Minister Bostic to give us closing comments at this time.
Yes, thank you, Lisa. And that was an interesting question, because I will end by saying this. I think it is really, really instructive that although we've had a number of cases, let's say, involving school children scattered at various schools across the country, but no spread within the schools, this tells me something. And I appeal to parents, to guardians, relatives. You see, when you are having symptoms or you're not feeling well, or you came into contact and you know that you have come into contact with a person who is positive, and you do not present yourself for testing, what this is doing, you are putting your children at risk. Because if you are positive and you remain at home, chances are your children will be positive. And this is why we are begging, I'm not even saying imploring, man, I'm begging people to come forward if you have symptoms, or come forward if you know that you've been exposed to a person who is positive. It is good for you, it's good for your family, it's good for the community, and it is good for the country. And my last word, look, we have been here before, and it has been a lot worse than this. We have learned from lessons of the past, and I know that we can overcome this, and relatively quickly, but we have to work together, and people have to do what they have to do. There's no need for people to bury their heads in the sand. There's no need for people to be frustrated because of the measures that had to be taken. There's no need for people to adopt any defeatist attitude whatsoever. We will overcome. We will beat this. We will. I give you that assurance, but we need you to cooperate with us so that we can do it together. Barbados is by no way or by no means overwhelmed. Our facilities are still in good shape. We have gone this route before, so we have contingency plans that we can go to if we run into problems later, if we require additional space, additional facilities. We are in a good place with our facilities, but where we are now with 40 positives today, that is not a good place to be. And I want you to help me to reduce these figures over the next 2 weeks. So work with us, Barbadians, work with us. Let's do this together. No retreat, no surrender.
And that is a good point on which to end. Let me thank the Minister of Health and Wellness, Lieutenant Colonel the Honorable Jeffrey Bostic, the Chief Medical Officer, Dr. Kenneth George, Dr. Leslie Rollock, the Senior Medical Officer of Health, the Manager of Quarantine Facilities, Mr. Alvin Hart, members of the media, and you for joining. Do have a wonderful evening.